Brianna France, nurse practitioner student at Auburn University, doing a 5-minute lecture on primary immunodeficiency disorder. There are over 300 primary immunodeficiency diseases. So, primary immunodeficiency disease is congenital, meaning a person is born with this disease, and basically it's where the immune system doesn't work like it should. If you'll remember, your immune system is made up of an innate immune response, and this includes your phagocytic cells, your natural killer cells, and your antigen-presenting cells. And these respond first to the infection and create a non-specific response. And then you have the adaptive immune response, which includes your T and B lymphocytes. And then these show up second and create an immune response to the specific antigen causing that infection. So primary immunodeficiency disease can be classified into groups depending on what kind of deficiency or malfunction there is. It could be a malfunction with the B cells or the T cells, and so on and so forth, as you see here. So what puts people at risk for this? As I mentioned earlier, it's congenital. A person is born with it, so therefore having a positive family history of primary immunodeficiency disease puts people at a higher risk for being born with it. So key questions and warning signs that you're going to want to ask. So as we said, a risk factor for primary immunodeficiency disease is having a positive family history. So you're going to ask your patient, do they have a family history of this? People that have this disease, they typically have infections that last longer, and they don't respond to treatment that a person with a normal immune response would. So you want to ask them, how long do the infections last, and does it respond to treatment? So if they tell you that they've had this infection and it just will not go away, and they've had pretty aggressive treatment, that should be a warning sign to you. And then last, a third key question would be asking, do they have a history of opportunistic infections, which means that they get infections from a certain bacteria, or they get uncommon infections that a person with a normal immune system just doesn't get. So some warning signs that you can also ask about is if they have 8 or more ear infections in a year, more so for kids. If they have 2 or more serious sinus infections, so these that are lasting really long and they have to have really aggressive treatment and it's still just hard for it to go away. Of course, if they have the pneumonia, 2 or more deep-seated infections in unusual areas, if they needed IV antibiotics just to clear a small infection that a normal person could take oral antibiotics for. And then, once again, the opportunistic organism infections. So physical exam components, really in children, you're going to see if they have poor growth, failure to thrive, the absent lymph nodes or tonsils, the skin lesions, petechia, a lupus-like rash, oral thrush after 1 year of age, and oral ulcers. Along with doing your physical exam, some of the lab tests you want to do a CBC with diff, and with this you're going to be looking for a decreased number of T cells, B cells, or platelets. You want to do a serum immunoglobulin measurement, so with those you're going to be looking for decreased numbers in any or all of the serum immunoglobulins, so IgG, IgM, and IgA. And then measurements of functional antibodies against immunized antigens. This means you're going to look and see if they have a decreased number or absent number of antibodies present after they receive a vaccine. And then some of the things that people could have done, of course, all newborns get a newborn screen before they discharge from the hospital. So those test for a good bit of primary immunodeficiency diseases, and we can see some of them you can see right after birth. So that's what that's for. And then some people can get genetic testing done too to see if they're going to pass it on, or if they do, or if they are missing something. So common treatments include IV immunoglobulin, and this is pretty much the standard of care. You can also do bone marrow transplants, antibiotics to treat the infections, and then gene therapy as well. All right, and then priority teaching, you're going to want to teach good hygiene, a healthy diet, dental care, keeping their teeth clean. They want to stay physically active, keeping their immune system up. You want to get plenty of rest and decreasing stress on the body, because you know that'll make you decreases your immune system, and it makes your infections last longer. And then you want to avoid exposure to crowds or people that you know are sick. And then here are some just specific immunodeficiency teachings that you should do. Like most patients with immunodeficiency should not receive the live virus vaccines. And most of them should also not receive the MMR and varicella. All right.